Hi, this is Brian Kim. I'm going to share with you case number 149 in the Best Way to Do Cataract Surgery series. This is a dense white cataract. I'm going to use Trypan blue. And you're going to see in slow motion double chop, cross chop mechanical fracturing techniques and how I'm able to disassemble the lens using reduced amounts of ultrasonic energy and as a result clear corneas postoperatively. So this is the eye. I'm going to use a cotton tip to steady the eye and center the eye. And this is a corneal marker, which will help me to center and size the rhexis. Using the cotton tip to steady the eye, I turn the eye towards the left, and then I make a paracentesis on the right side, and then the left side, making sure I'm parallel to the iris plane, which creates a nice corneal shelf, which will allow me to achieve a self-sealing incision. That's intracameral lidocaine, and then intracameral epinephrine, and then intracameral air, and then some Trypan blue. I'm trying to paint the anterior capsule surface with the Trypan blue and using it sparingly, trying not to expose the cornea to the dye. This is dispersive viscoelastic to coat the corneal endothelium and to push the dye and the air bubble out and to flatten the anterior capsule. This is a triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel through the cornea, and then when I'm ready, I turn the eye towards me a little bit, and then I enter. And that move dictates how long my incision is. This is the puncture style technique because this might be an intumescent lens. So I'm using a needle to puncture the center and then I'm going to aspirate any potential cortical milk. So as I do this maneuver, I can see that there's really not that much milk coming out. So as a result, I'm going to go in with the rhexis forceps. And I do have a marker there, so I use that marker on the rhexis forceps to kind of help guide the diameter, since with the Trypan blue I can't see the corneal mark that I made earlier. So I'm going slow and being careful, making sure that the rhexis is appropriately sized and centered, and watching and being mindful that it doesn't try to radialize. But again, I didn't see any milk, so I don't believe this is an intumescent lens. So go ahead and finish off the rhexis, burp some viscoelastic out. And this is the Capsulorhexis hydrodissection technique. I place a cannula under the rhexis edge contra-incisionally, point the tip down, get a nice wave decompress on the left side, and then hooking the peripheral lens on the right side, and the lens begins to spin. Get that little bubble out. Adjusting my sleeve, irrigating the surface of the eye, lifting the incision with the chopper, going in with irrigation off to minimize Descemet's trauma, removing the surface epinuclear material, and here we go. And place the chopper under the rhexis edge contra-incisionally. Again, you see I'm having the tip pointed outward, and as I go under the rhexis edge, I rotate my hand, I'm supinating, and now it's more vertical, but it's pointed towards me. The tip is pointed towards me a little bit. I have the phaco tip vertically subincisionally, rotating it, and I'm stabbing on both sides. It's slightly a diagonal vector force, slightly from underneath with the chopper and slightly above with the phaco tip. With those diagonal forces, I'm able to fracture the lens completely in half with the double chop maneuver. I place the chopper around the right heminucleus, pulling it centrally towards the phaco tip, pulling it centrally, and then fracturing the right heminucleus against the phaco tip with the cross chop maneuver. And now with those maneuvers, I have 3 separate pieces. I use some vacuum to lift that first quadrant up out of the bag, and then using mechanical fracturing forces, I'm crushing the lens between the instruments. Again, I do this without utilizing any ultrasonic energy or vacuum. I don't have to lollipop the lens. I don't have to stab it and impale it. And by doing it this way and using opposing forces, I have a lot of versatility and flexibility. I can fracture the lens in a variety of different ways. By just using crushing forces, I'm able to break down the lens. And then when the pieces are small enough, then I can just use a little bit of ultrasonic energy and vacuum to remove the pieces. So again, I'm crushing the pieces between the instruments, and then once they're small enough, I'm able to emulsify the lens piece. So that first quadrant is out. I'm trying to loosen up the second quadrant, separating it from the other half there, using some vacuum to grab that little piece. Doesn't really want to come. I'm separating it some more, and then using some vacuum to lift it up a little bit, and then sandwiching the lens between the instruments, crushing it and dividing it, and then emulsifying the lens piece. Again, repositioning that piece on the tip with some vacuum, and then crushing the lens piece between the instruments, and then emulsifying the lens pieces. I like to use a lot of mechanical fracturing forces here, because by doing it this way, I know I'm just utilizing mechanical forces, which again is safer for the cornea. I turn that second heminucleus in front of me, placing the chopper around the lens piece, pulling it centrally toward the phaco tip. The phaco tip is positioned deep in the bag. I'm able to fracture the lens completely in half very easily. Place the chopper around a third quadrant there, positioning the phaco tip deep in the bag again, fracturing the lens piece. And the reason why I place the phaco tip deeper in the bag is because you are able to get a more direct opposing forces around the lens by doing it this way. Because again, the chopper is deep, the phaco tip is deep, you're able to sandwich the lens piece more confidently and through the entire piece. If I keep the phaco tip on the surface, then I'm only going to chop the top part of the lens piece. But by having the phaco tip deeper, I'm able to fracture and divide that piece completely in half with the mechanical fracturing forces. So you can see I'm doing mechanical fracturing forces successively over and over again. And then once the lens pieces are small enough, then I go ahead and use sparing amounts of ultrasonic energy and vacuum to remove the lens pieces. So, using a little bit of vacuum to position the lens piece on the tip, and then just crushing the lens piece between the instruments. And while that big piece is in the eye there, I'm able to be confident with the ultrasonic energy and vacuum, because I know that that last piece is keeping the posterior capsule back. So that's very important. When you know that you have that last piece, you can be somewhat confident and buzz and using the ultrasonic energy and vacuum in that space and know that the posterior capsule is not going to come up. So push some more viscoelastic in to coat the cornea again. I place the chopper around that last quadrant, pulling it centrally towards the phaco tip. Again, the phaco tip is deep. I'm able to sandwich the lens from top to bottom, fracturing it completely in half, and then using successive mechanical fracturing forces, again, to crush the lens piece over and over again. And then once the piece is small enough, I'm using ultrasonic energy and vacuum to emulsify the lens piece. So again, you're just hugging the lens between the instruments and then crushing it. Because of the length of the chopper, you really have a lot more flexibility and versatility and ability to get around the lens with the chopper and then crushing it, again, sandwiching the lens between the chopper and the phaco tip. So this is the last piece, but I have the chopper deep. Oh, there's one more piece in the bag here. So using some vacuum to grab it, hold it, and then sandwiching the lens. Again, during that maneuver, I'm sandwiching the lens. The posterior capsule is exposed to me, but I'm sandwiching the lens purely under irrigation. So this is a very safe maneuver. I'm not going to buzz the capsule when I do this, but then when I'm ready, I'm able to go ahead and buzz it by protecting the posterior capsule with a chopper. So I take the chopper out, push BSS in, take the phaco tip out, and I go in with the INA handpiece. There's some loose epinuclear material. I go after that first. Start sub-incisionally removing the cortical material. It's a fairly thick sheet. Looks like that's still a little bit of epinucleus there. So remove that floating piece of epinucleus, switch to polish mode, polishing underneath the rhexis edge of the lens epithelial cells, removing any remaining cortical material. The polish mode is really excellent because I'm able to grab pieces of cortex deep into the capsular bag, but I'm able to do this confidently without worrying about grabbing the capsular bag or stripping any zonules in the process. It's a very gentle setting. And you can bounce back from cortex mode and polish mode depending upon if you need a little bit more vacuum. You can switch to cortex mode, but then you want to go back to it, you can switch back to polish mode. And I'm doing this with the foot pedal. As you can see, I'm taking a lot of time cleaning up the bag. I think this day and age, when you're doing cataract surgery, you really have to clean the bag meticulously, especially because with refractive cataract surgery, if the patient needs a lens exchange in the future, doing all this careful cleaning is very important. You can see I'm pulsing BSS into subincisional space. You can see all this lens material is being liberated. So you're going to have some type of maneuver. You can use bimanual IA, but I choose to pulse BSS into the subincisional space, and this gives me a lot of confidence that that area is clean of any lens material. So you see that's a pretty big sheet. Switch to cortex mode, I'm able to eat that piece up, switch to polish mode, and searching for any more pieces that might be hiding from me. So we'll go ahead and fill the capsular bag with some cohesive viscoelastic. And this is the capsule sweep. Start sweeping on the left side first. Oh, see? So by approaching the subincisional space in a variety of ways, I first pulse it with BSS. I was able to loosen stuff up. And then now I'm using the sweeper, which I'm able to get pretty deep in the capsular fornix. And now you see that big chunk of cortex comes out. And so I have multiple ways, and I sweep it from both sides. So I sweep on the left side, sweep on the right side, but I'm able to access the subincisional area both ways. And again, I also pulsed with the BSS. So having multiple ways to get to that area, I think, is crucial to really get a nice clean bag. So this is a single piece acrylic lens. It's going into the capsular bag. And then I go ahead and quickly transition to the INA, go in with irrigation off, activate irrigation, go underneath the lens, tilting it, rotating at 90 degrees, removing the viscoelastic from within the bag. You saw it ate that big chunk of cortex. Repositing the optic back down. Polishing underneath the rhexis edge some more. Invariably, once you put the lens in and rotate it, it can also loosen some more potential lens material. Switch to visco mode, removing the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So again, this is a dense white cataract. I put Trypan blue in, and then you saw the double chop, cross chop, mechanical fracturing techniques. Fairly dense lens, but you can see the CDE is only 3.65. I was able to perform double chop. You saw it in slow motion. I placed the chopper under the rhexis edge and out to the capsular fornix. I'm hugging the lens from the periphery, but also slightly from below. I tilt the phaco tip vertically subincisionally, and by doing it that way, I'm stabbing into the lens piece. It gives me some leverage, almost like a grip on the lens. And then I have diagonal vector forces. So I'm pulling centrally and then upward a little bit with the chopper, and I'm pushing down and horizontally towards the center a little bit with the phaco tip. These equal and opposing forces causes the lens to just fracture because of that direct opposing force on the lens. And when it fractures in half, that's the double chop maneuver. I place the chopper around the right heminucleus, and because the phaco tip is deep between the fracture point, I'm able to pull the chopper centrally, and then it encounters the phaco tip, and then it fractures the right heminucleus in half. So again, this is the most efficient way, I believe, to disassemble the lens, especially when you're considering a dense lens like this. You're not using any ultrasonic energy or vacuum to perform those maneuvers. I'm able to fracture the lens pieces in smaller pieces, again, without using any of the fluidics, which gives you a lot of versatility. It's safe to the posterior capsule. And as a result of using less ultrasonic energy, I do find that postoperatively, these patients look really, really good. And this patient did very well. So I hope this was helpful to you, and I thank you for your attention.